Away from matters education, let's take a look at matters health as the Kenya Kwanza administration struggles to implement the universal health coverage UHC. Frequent unrest, conflicting laws and inaccurate data have been identified as key factors derailing its progress. The Presidential Task Force on Health informed the National Assembly's Health Committee that the numerous laws governing the sector has made it difficult to manage healthcare workers who fall into at least 43 different cadres. In a shocking revelation, the task force chairperson, Professor Kama Rogo, told the committee chaired by Endebe's Member of Parliament, Robert Pukose, that the two principal secretaries in the State Department of Medical Services and Public Health do not communicate with each other, a situation that continues to hinder the implementation of both preventive and curative healthcare services. Our health and science reporter, Chebet Birir, tells us more.
The Presidential Task Force on Health Committee, gazetted by President William Ruto in July last year to look into matters affecting health workers, has found that the country has no data on the total number of healthcare workers in the country. The distribution and qualification of health workers in respective cadres also remains unknown. Christine Okoth, a member of the committee, added that the country also lacks updated health data and the little at its disposal is held by donors such as the USAID.
We do not understand how many health workers we have, how many are being produced, and no one single source can give us substantive information.
KEMRI has a budget of 10 billion a year. We only give them 2.7. The other 7 billion is donor money. So they are not doing our research. They're doing somebody else's research.
During the session, the Presidential Health Task Force also told MPs to address the teething issues facing the implementation of Social Health Authority, SHA. The task force admitted that the health scheme is faced with numerous challenges that need fixing to ensure that the system functions smoothly.
They've been a little bit slow. You know, people tend to take advantage of where there is no law to do their own things. So they have not been very cooperative in terms of having legislation in place. But we already have a proposed legislation which is before this committee, and we've written to the Speaker for pre-publication scrutiny.
However, with health being a devolved function, governors have not been keen to have the formation of a commission since they feel it claws back the gains so far achieved. Even as health workers push for the employment of more professionals, the committee was informed that several individuals manning hospitals are not professionals.
I'm yet to see people who wake up in the morning and go to their offices or in the hospital to serve Kenyans. Very, very few. And those who do in this sector become the enemy of the sector.
These issues come at a time when healthcare workers in the country, including doctors, nurses, clinical officers, and laboratory technicians, have been taking industrial action due to unmet demands. Some of the health providers have been demanding the implementation of collective bargaining agreements, the actualization of return to work formula, and the employment of more health workers, among other issues. Chebet Birir, KTN, Nairobi.
Just ahead in business.